A fly too close, a rare case of necrotizing myiasis-associated Ignatianaria larvae bacteremia and its expanding ecological relevance. Ignatianaria larvae is a rare gram-negative bacillus first isolated from the maggot larvae of the flesh fly Wolfhartia, which typically cause myiasis in livestock such as cattle, goats, and horses. Human infestations are uncommon but have been described in debilitated or neglected individuals with larvae infesting the ear, eye, mouth, nose, or open wounds. Scattered case reports describe clinically significant systemic sepsis and bacteremia due to Ignatianaria larvae in the context of myiasis, suggesting a zoonotic transmission of this bacterium from maggot to human host. While most infections have been associated with rural or agricultural exposures, emerging urban cases highlight the potential for under-recognized ecological spread and broader public health implications. Here, we present a case of Ignatianaria larvae sepsis in an urban context. A 61-year-old woman with schizophrenia and chronic lower extremity edema presented after a fall had left her immobile on the floor of her home for a prolonged period. Emergency medical services found her in poor condition, noting an unsafe and uninhabitable environment with garbage scattered throughout the house, as well as flies and eggs surrounding her. On examination, she had a 12 by 5 centimeter superficial wound on the posterolateral right calf with active maggot infestation, surrounding tissue breakdown, and clear evidence of neglect. She was transported to the hospital for urgent evaluation. At presentation, she met criteria for sepsis with tachycardia at 112 beats per minute, leukocytosis of 12.6, and elevated lactate of 4.0. She was also noted to have rhabdomyolysis with creatinine kinase levels near 3500. Aggressive intravenous fluid resuscitation rapidly corrected her metabolic derangements. The patient's psychiatric comorbidities and acute anxiety and aggression made it impossible to obtain pictures of the wound, but the maggots were identical to those shown above from this case in reference 1. After initial stabilization of her psychiatric symptoms, the wound was manually decontaminated, superficially depleted of necrotic tissue, and empiric vancomycin and piperacillin tazobactam were initiated in the context of sepsis. Imaging was consistent with superficial cellulitis without evidence of osteomyelitis or a deep tissue abscess. During hospitalization, the patient's care was complicated by ongoing psychosis and limited engagement, making consistent treatment and follow-up challenging. Podiatry was consulted and performed additional wound care and bedside debridement. Microbiologic evaluation revealed multiple sources of infection, including a positive nasal swab for MRSA, urine culture growing E. coli, and wound cultures positive for Group G Streptococcus and Providentius stuarti, all susceptible to the ongoing antibiotic regimen. With supportive care and continuation of these antibiotics, she demonstrated steady clinical improvement and was discharged to a nursing facility for further rehabilitation and wound care. Blood cultures obtained on admission initially showed anaerobic gram-negative bacilli that could not be immediately speciated, and hence a source was not clear. 3 weeks after discharge, the isolate was definitively identified as Ignatianaria larvae, a rare organism associated with maggot infestation and zoonotic transmission. Susceptibility testing confirmed sensitivity to piperacillin tazobactam, confirming that the empiric regimen had provided adequate coverage. The patient was subsequently admitted to the behavioral health unit a few weeks later for acute psychosis, and follow-up examination during that admission demonstrated appropriate wound healing and no persistent signs of sepsis. In conclusion, this case demonstrates Ignatianaria larvae infection in an urban environment without livestock exposure, underscoring its spread beyond traditional reservoirs. Such an occurrence highlights the ecological adaptation of the organism, the risk for under-recognition in underserved populations. Clinician vigilance is essential to identify rare zoonotic infections in urban contexts and to appreciate their broader public health impact. Thank you.